Today we're going to be talking about nervous system and musculoskeletal disorders. So the first one we're going to look at is a stroke. It is also known as a cerebral vascular accident, or CVA. A stroke is a disease that affects the arteries that supply blood to the brain. So the majority of our strokes actually occur from atherosclerosis, that buildup of fat and cholesterol in the arteries. That can happen in arteries throughout your body, including the arteries to your brain. And then over a period of time, they start to narrow and the blood can't get through them as well. And then the blood can actually form a clot right there and block blood flow to part of the brain. So when a person has an embolic stroke, which is the most common type of stroke to have, it's usually caused by a combination of that atherosclerosis and a blood clot that forms there and keeps part of the brain from getting blood and oxygen. Now, the type of symptoms or the type of disability that this could potentially cause is great, but it's really going to depend on what part of the brain is impacted by this. Another way that a person has a stroke is when a blood vessel in the brain bursts, and that is frequently caused from hypertension, or it can be from a weakened artery from some reason, and then they bleed into the brain. That's called a cerebral hemorrhage. So a stroke is the 5th leading cause of death in the United States, and that has improved. It used to be the 3rd leading cause of death in the United States, and it's dropped down to the 5th leading cause. It is the number 1 cause of disabilities, though, in adults. Number 1 cause of disabilities. And then another term that I want you to know is a transient ischemic attack, or a TIA. Some people will refer to it as a mini stroke, but this is when the person has all the symptoms of a stroke and then it goes away on its own. Transient, meaning it came and it went. So they have these warning signs of a stroke and it only lasts for maybe 5 or 10 minutes and it goes away on their own and they think, oh, well, that was weird, but I guess I'm okay. And they don't pursue it and they don't go get help. A TIA is a warning sign usually that a person is going to be predisposed to a larger stroke. So it's definitely something that you don't want to ignore and the person should get help for. So this picture here is showing you that atherosclerosis that's building up and blocking off part of the blood supply. Generally, it doesn't block it off completely like that. It'll block it off part way and then a blood clot starts to form. Or we can get embolic strokes. Back when we talked about that surgical patient and we talked about how, when a person's not moving their legs, how they can get a thrombus or a blood clot in their legs. And then it can turn into an embolus where it branches off and it moves and gets stuck in another part of an artery in another part of the body. That can also happen here up and cause a stroke. Now, if it happened here, this part of the brain wouldn't get blood and oxygen. So different parts of your brain do different functions for your body. And so depending on what part of the brain is affected by this is going to depend on what we're going to see symptomology-wise. Now, our risk factors for a stroke or a CVA, and remember, risk factors are habits or characteristics that predispose a person to that disease process. Age. As we get older, we are automatically at a higher risk of getting a stroke. Family history. So your risk is going to increase if a parent or a sibling had a stroke. It is automatically you're going to be at a higher risk for it. Gender, both men and women are affected. It used to be men had higher rates than women, but that is no longer the case. But as far as race goes, they have found statistically that blacks are at greater risk than other groups. And blacks tend to be at higher risk for hypertension as well. So that may be part of that correlation. Now, hypertension or high blood pressure. Now, remember, according to the American Heart Association, the American Stroke Association, the National Institute for Blood Pressure, they are now using the figure that over 130 over 80 is what is going to be considered hypertension. Now, we don't necessarily treat a person just off of one isolated reading. You can go into the doctor and your blood pressure can spike because you're nervous about going there. And they'll just tell you to come back and check it again. And they'll watch it for a little bit and see if you're trending higher than normal. Okay, they usually don't treat one isolated reading unless it's really high. Smoking puts you at risk of strokes, heart disease, high blood pressure, all of it. Diabetics will put you at risk for stroke. High blood cholesterol, because that causes that narrowing, that atherosclerosis or narrowing of the arteries. Obesity puts you at higher risk of having a stroke, and then a previous stroke or a TIA automatically puts you at that risk factor. Now, as far as warning signs that a person's having a stroke, it can occur suddenly, and you'll see sudden numbness or weakness on one side of the body, the face, the arm, the leg. It's called hemiplegia. So remember when we talked about paralysis, we said hemiplegia. Hemi is half, so half of the body. So paralysis on one side of the body. Paraplegia is, para is 2, so the legs are paralyzed. Quadriplegia, quad is 4, arms and legs, so they're paralyzed from the neck down. But we tend to see hemiplegia with strokes, sudden confusion, trouble speaking or understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sometimes people complain of the worst headache they have ever had right before this happens. Now, in the hospital, we used to use a term called FAST to help you remember what to look for a stroke, but nowadays we use B-FAST. And the B stands for balance. Is there a loss of balance or coordination? Dizziness, lightheadedness, where their equilibrium feels a little bit off to them. E is for eyes. Do they have blurred or double vision or having difficulty seeing for some reason all of a sudden? The F stands for face. Just have them smile. And is only one side of the face going and one side is drooping down? Arms, you just have them hold out their arms, and if one arm is starting to drift. Speech, give them something to say. Ask them for their address. Give them, an expression to say. And are they having a hard time getting their words out? And then time. We always want to note the time of when they were last known to be normal, because we do have a lot of treatments that we can do for strokes now, but some of them are time dependent. And if you don't get the treatment started within a certain amount of time of the onset of symptoms, the risks are going to outweigh the benefits that the person might have. So it is really important, really critical that we teach people if they're having anything like this, they come in immediately and get help. And we would prefer them to call 911 than to try to drive themselves or have a loved one drive them and potentially get in an accident. So if the person survives, there's a good chance that they will have some kind of residual brain issue. Functions, again, are going to depend on the area of the brain that's damaged. But as soon as we stabilize them, as soon as they are stable, rehabilitation starts. We want to get rehabilitation started as soon as we can to help them gain their highest possible level of functioning that we can do. Now, another disease process we're going to look at is Parkinson's disease. Parkinson's is a slow, progressive neurological disorder that has no cure to it at this point. And muscle movement is really affected. The centers in the brain that impact muscle control is really going to be impacted. So the really common signs and symptoms we see with it is tremors, just uncontrolled tremors. You'll notice rigid, stiff muscles in the arms and the legs, slow movements. They move really, really slow, and they have almost what we call a shuffling gait, where it looks like it's hard for them to pick up their feet. They start stooping forward, so they tend to lean and tip forward, and their balance is going to be really impacted. They're going to be a huge fall risk because they don't pick up their legs well. They have a shuffling gait. Their arms are really rigid. Their balance is thrown off. They're having these tremors, and it just really sets somebody up for a potential accident there. The other thing that you'll notice that's fairly common with Parkinson's disease as well is a mask-like expression. Their face just doesn't show. It's like they try to smile, but the muscles in the face aren't moving. Treatment is going to depend. There are medications to help control the disease, to help slow the progression of the disease, but not a cure for it at this point in time. So exercise is important. It's really important that they stay active and keep as much of their muscle mass as they can. Physical therapy, very important. And then they will usually also have them work with therapy for speech and swallowing problems. You'll see people with Parkinson's, a lot of times they are so soft-spoken you can hardly hear them, and a lot of them will have issues with dysphagia as well. So the person may need a lot of help with eating and self-care depending on how bad the Parkinson's has progressed, and they are going to need a lot of safety measures as well to help prevent falls and injuries. Another disease that we will see quite a bit with our elderly is MS, multiple sclerosis. It is a very chronic disease, which we do have treatments for to help slow the progression of it down, but again, we do not have a cure for it at this point. But the myelin, and myelin is a protective covering that covers your nerve fibers in the brain and the spinal cord. And in multiple sclerosis, the body attacks itself and it attacks the myelin. And so then the messages from your brain can't get down to the nerve fibers, down to the parts of the body where it needs to go. So the person is perfectly awake and alert and understands everything that's happening to them, but the messages aren't getting sent to where they need to go. They lose a lot of their, they'll lose their muscle movement. So nerve impulses are not sent to and from the brain in a normal manner. So the signs and symptoms, again, will depend on the damaged area, and it can include vision problems, muscle weakness, balance problems are a really big deal with this, tingling, prickling, or numb sensations, partial or complete paralysis, pain, speech problems. So that partial or complete paralysis, patients do have like periods of remission where they are taking their medication and their symptoms seem to really dampen down, and it's not that the disease is gone, but they seem to be able to function really well. And then sometimes it will flare up and the person will get so weak they can't even walk during that time frame. Now, as this disease progresses, they may end up not being able to move at all. We do have a couple residents in the nursing home right now that they are completely dependent, awake, alert, there's nothing wrong with their cognitive function. They understand everything that's happening to them, but they no longer have control or movement of their body anymore, and they are completely dependent for care. So you'll see a large range of type of patients that you might take care of. I have a girlfriend who has MS. She has had it for 12 years now, and she's still doing absolutely everything. When she gets sick, when her immune system's a little bit weakened, it tends to flare up and she'll have more issues with balance issues, coordination issues, but most of the time she does really well with it. So you're going to see a really broad range of different varying symptoms with this. So we also might see tremors, dizziness, problems with concentration or attention or memory issues. A lot of people get depressed with this. It would be hard not to, when you can't move your body the way you want to. Bowel and bladder problems. A lot of people cannot empty their bowel or bladder, or they'll become incontinent of bowel and bladder. A lot of times with MS, the bladder tends to retain urine instead of excreting it out. And so they will actually end up needing long-term catheter in. And so then a lot of times they will do a suprapubic catheter where they put the catheter over the top of the bladder because it can stay cleaner that way. It's put in through surgery. The physician puts it in, but it's easier to keep it clean than if the person has to have a urinary catheter long-term and it's down. And then if they have no control over their bowels and it gets up around the tube, there's more chance of infection. So people with MS are kept active as long as possible and as independent as possible. But as their care changes, as they become more dependent, their care plan is going to reflect all that extra care that's going to need to be done for them. Now, head injuries result usually from trauma. Remember, trauma is an unintentional injury, and it can be to the scalp, the skull, or the brain. So a traumatic brain injury occurs when sudden trauma occurs to the brain and the brain tissue is bruised or torn. Bleeding can happen in the brain or to nearby tissues. Spinal cord injuries can happen with this. And we see this a lot with car crashes, falls, firearms, assaults, and sports and recreational injuries, riding quads, riding dirt bikes. Football is a big one for this. If the person survives a traumatic brain injury, there is usually a lot of times there's going to be some type of permanent damage that's going to be residual with it. So indications of a head injury, you might notice loss of consciousness where you can't get them to respond, scalp wounds, and scalp wounds tend to bleed a lot, fractures, swelling and bruising, blood coming out of the nose or the ears, stiff neck. So a disabilities depend on the severity and the location of the injury, but they can be cognitive disabilities where they actually, can't think and rationalize the way they used to, sensory problems, communication issues where they can't say what they're wanting to say, or they can't understand speech anymore, behavior or mental health problems, or a person can be in a coma where the person is unconscious, not responding, not aware of what's going on. They can't be aroused. Rehabilitation is always going to be required, usually for traumatic brain injury patients. Now, spinal cord injuries can permanently damage the nervous system, and we tend to see this the most with your young adults. They tend to have, your teenage boys, young adult men tend to try to do things that are a little bit riskier behaviors. And we also see it with stabs or gunshot wounds, motor vehicle crashes, falls, and sports injuries. And where the damage is to the spinal cord would be the level of injury or the level of disability that we might notice. So I was talking about, when we talked about the stroke patient, I talked about hemiplegia, paralysis on one half of the body. But paraplegia is paralysis below the waist. So generally you will see, if they have injury to the lumbar vertebrae where it's actually damaged the spinal cord, they will be paralyzed in the lower legs. So from about T6, about halfway through the thoracic vertebrae, all the way down, that would give you paraplegia. So sometimes people are paralyzed just the legs, but they still have trunk function. If it's up in the thoracic area, you'll generally see trunk function. They'll have no bowel or bladder control. Higher up in the thoracic area, in the lower cervical area, you're going to see quadriplegia, where their arms are going to be impacted. And of course, the higher it goes up, the higher the level is that we tend to see paralysis below the level of the neck. Now, a couple musculoskeletal disorders we'll talk about. Most common one that we see with our elderly is arthritis, and generally osteoarthritis with our elderly. It means joint inflammation. It's the most common joint disease that we'll see. And so there's osteoarthritis and there's rheumatoid arthritis. Osteoarthritis is the most common. It is degenerative arthritis. And usually that happens from old injuries, from being overweight chronically, aging. It's just the bones just become gnarled up, and bone spurs happen and cartilage breaks down. And so it's very painful and very uncomfortable in the joints. Some people, there is a big family heredity factor to it. So if you have parents that have arthritis, there's a higher chance that you might have it as you get older, and especially once you start throwing these other risk factors in combination with that. So if you have a family history, you've had joint injuries, you're overweight, you're getting older, you're going to have obviously a much higher risk. So osteoarthritis causes joint stiffness, pain, and swelling. And there really isn't a cure to get rid of it, but there is surgery. We can do joint replacement surgery, which is called arthroplasty. So they can actually, what they do is they actually take the person in, saw off the old joint. They saw off the old joint from the bone and put a metal or a prosthetic joint in there, and then attach the bone, your regular bone, back to it. Painful surgery. And it takes a while for things to heal before it will feel good. But if they don't need the joint replacement surgery, they'll usually start with medications to decrease swelling and relieve pain. And I know I have heat here and sometimes cold application, but a really common thing to see is with heat is applying heat before exercise to kind of, remember, heat dilates blood vessels. It brings more blood flow to that area, and then the person can move it easier. But then after the movement and the exercise, it tends to swell up, and then they put cold on it to decrease the swelling and to help with the pain control. So it's a lot of times heat before an activity, ice after the activity is pretty typical to see. Very important that people with arthritis keep moving. You've seen the commercials, a body in motion stays in motion, and it's very true. Sometimes people don't want to move because they hurt, and then it just ends up getting worse. Rest and joint care, weight control, really important that if you have a lot of arthritis that you try to maintain a normal weight and have a healthy lifestyle. Now, rheumatoid arthritis is a chronic inflammatory disease, but this one, it's autoimmune where the body is actually attacking. It's not degeneration from wear and tear. This is your body is attacking the joints, and they become very painful and swollen. They're tender. People tend to feel tired, run low-grade fevers, and the symptoms can last for a long time. And generally, if you see it on one side of the body, we tend to see it on the other side of the body, where with osteoarthritis, you may just have it on one side. Our treatment is, again, to relieve pain, reduce inflammation, slow down or stop the joint damage, try to improve the person's sense of well-being. They have a lot of gadgets to help if people don't, if their hands are weaker. Hands are a really common place that we tend to see rheumatoid arthritis, and all those small joints in the hands start getting all gnarled up. So they have a lot of tools to help a person have, better control or be more independent. Person's care plan can include rest, balanced with exercise, proper positioning, joint care, regular exercise still, even though they hurt, weight control management, trying to decrease stress, and of course, trying to prevent falls. So that arthroplasty is the surgical replacement of a joint. We tend knees and hips are the most common place to see it, knees and hips. But surgery is done to relieve pain. When the pain just gets so bad to a person's joints that they no longer have a good quality of life, it's time for a joint replacement. So it will restore or preserve joint function and correct a deformed joint. And they saw off the old joint and screw on a new one. It's a wicked surgery to watch. You can actually go on YouTube and see a joint surgery. Now, fractures. A fracture is a broken bone. There's closed fractures or a simple fracture where the bone's broken but the skin is still intact, or an open fracture or compound fracture where the bone has actually come through the skin. And this happens from falls, car accidents, bone tumors, metastatic cancer. Osteoporosis can do this, where the bones are just becoming weaker. So signs and symptoms: pain, swelling, loss of function, limited or no movement of the part, movement where motion should not occur, deformity, so the bones they don't even look like the person's arm is going in the correct direction, or leg, or whatever they tended to break, bruising and skin color changes at the fracture site, and they can bleed internally or externally from it. So casts tend to be made of plaster of Paris or fiberglass generally. And sometimes people actually need traction. Traction reduces and immobilizes fractures, and it's also used to help treat muscle spasms or to correct deformities, and that's where they use weights and ropes and pulleys to kind of hold things in place. It's really wicked. These are different types of casting. So generally a cast, there's short-term casts, long-term casts, there's body casts and all different variations, there's leg casts. But we always want to check the circulation below a cast. So if the person here had this cast on their arm, we would check the fingers. Are they numb? Are they tingly? Are they turning colors? Does the color look good? We can pinch the nail beds. Remember, that's called blanching. Blanch the nail beds and it'll kind of turn white. Make sure the color comes right back. So you always want to check the circulation below a cast site to make sure blood flow is getting all the way through it. Usually, whatever the extremity is broken, we will prop it up on pillows to try to keep it elevated a little bit. And they can actually still put ice even over the cast. They will put it in, of course, a waterproof bag, but they can actually put ice through a cast, or put ice on the area as well. Now, hip fractures are very, very common in our elderly population, more so in women because they tend to be more prone to osteoporosis. But hip fractures, the healing is just slower in our elderly population. They're, again, with any surgery, but they tend to be at risk of pneumonias, atelectasis, that collapse of the alveoli, urinary tract infections, thrombus, blood clots in the leg veins and embolus where they can travel. pressure ulcers, constipation, all of these are really common after a hip fracture because they're not moving the same that they did. So the fracture requires internal fixation. So the fracture here, so this is the neck, this is the hip right here, this joint right here. It's usually right here at the neck where it tends to break a lot. And so they will have a prosthetic replacement put in there. And so it's really important, extremely important, when a person has knee surgery or hip surgery, don't start doing range of motion to that joint without checking with the nurse or the physical therapist. Because if you cross somebody's leg with a hip fracture, you cross it over the other leg, it can pop that joint back out of place. So if I took this leg and I crossed it over this leg, this joint that they just surgically put in and pinned in can pop out. You don't, when a person sits down, you always want to make sure that their knees are below the hips. You don't let them sit down in something so low that the knees are higher than the hips. And so there's safety issues that we want to think about when we have a person that has had hip surgery. And so anytime when you're going to be moving patients with hip surgeries, always just check in with the physical therapist or the nurse and make sure you know what restrictions that person has before you just start moving them. Now, the term osteoporosis, I think my favorite commercial I love is it's a milk commercial, and the guy's mowing the lawn, and the mom's trying to tell her kids, you know, you got to drink milk or your bones will become weak. And they're looking out the window and they see this older man mowing the lawn, and his lawnmower gets away from him and his arms just break off and go with the lawnmower, and all of a sudden they start guzzling their milk. It's not quite like that, but osteoporosis, the bones become really porous and really brittle, and they tend to break really easy. And women, this happens more commonly in women after menopause. So though it does happen to men, we tend to see it more commonly in women. But what happens here is you normally have holes in your bones. I mean, you normally do have holes in your bones. And that's where blood flow and stuff goes through. But in osteoporosis, the hard bone matter weakens, and these holes get bigger in here. And so then there's not as much hard bone matter, and the bones break easier. So it's really important while you're younger and your bones are taking in the most calcium they will ever take in to get nice and strong, that you make them nice and strong. But things that predispose you to osteoporosis is family history, being overly thin. I think this is the one advantage you have if you're overweight. People that are overweight don't tend to have as many issues with osteoporosis as people that are thin and have small frames. Eating disorders, people that have been anorexic, bulimia, they tend to have a lot more issues with osteoporosis as they get older. Tobacco use, alcoholism, lack of exercise. You need weight-bearing exercise to build your bone matter nice and hard. So when I say weight-bearing exercise, even though swimming is a fabulous exercise, that's not weight-bearing. I'm talking about walking, okay, running, dancing, something where you're on your feet, where you're putting weight on those bones. Bed rest, if a person's on bed rest for any length of time, they say after 10 days of bed rest, you can actually start losing bone matter. Immobility. So signs and symptoms, back pain, gradual loss of height. You'll actually see people as they get older are getting shorter because their bones are weaker and they're starting to compress down some. Stooped posture where they can't even hold their head up properly. And then just frequent fractures where their bones start breaking. So this shows you a woman at age 40, at age 60, and at age 70. So really important that we keep our bones healthy and nice and strong. And your bones take in the most calcium they'll ever take in from teenage to young adult. Then it tends to be the calcium we take in tends to help us maintain what we have. And then as we get older, we do start losing some bone mass. So we do want to get those bones nice and strong when we're younger if we can. So the best thing you can do is make sure you're taking in enough calcium. Now remember, if you take in calcium, you've also got to have vitamin D. Vitamin D is our sunshine vitamin, but if you're not out in the sun on an everyday basis, you might want to think about vitamin D supplements because you have to have vitamin D to be able to absorb your calcium. This tends to happen more to women after they've gone through menopause and they start losing estrogen. So they will sometimes recommend estrogen replacement for women. Strength training exercises. So calcium, vitamin D, strength training, okay, weight-bearing exercises, very important. Not smoking, limiting alcohol and caffeine. Some people actually use back supports for good posture so their body doesn't start pitching forward. Safety measures to prevent falls and accidents, good body mechanics, all of those can really help a lot. And then amputation. Amputation is loss of a limb. It's the removal of all or part of an extremity. Most amputations involve a lower extremity, and common causes are severe injuries. You'll tend to see this, generally, this is from a car crash or a motorcycle crash, a wartime. Our veterans a lot of times end up losing extremities due to war issues. Otherwise, the most common reason you're going to see this is diabetes. I mean, I kid you not. If your amputation if it wasn't a war vet, I would bet you money that the person has diabetes. And so you can also see it from tumors. But when part of the tissue dies, it turns gangrenous. Gangrene is death of the tissue, and the only way to get rid of gangrene is to cut it off. So sometimes when we talked about vascular disorders, arterial ulcers, pressure ulcers, and we said if it doesn't ever heal, if the tissue starts dying, then amputation is going to be all that option you have to get rid of the dead tissue so it doesn't keep spreading and get into the system and cause problems throughout your entire body. So gangrene is a condition where the death of the tissue happens. It usually starts from an infection, an injury, or a vascular disorder. Again, surgery is the way we're going to deal with it. And if it's untreated, it tends to spread throughout the body and it can cause death. So the nice thing, though, is we can do a prosthesis for this person. So if they lose their leg, they lose their arm, they can have a prosthetic device so they can still function and have a normal, healthy life and be able to do things for themselves. It takes a lot of rehabilitation and a lot of treatment to learn how to use that prosthetic device, but they do work very well. And a lot of people, when they do have an amputation, they're going to have phantom limb pain. Their body, even though they understand, and please don't ever tell someone when they have had their leg cut off and they're telling you they feel like their leg still hurts, and you're like, oh no, it's been cut off. That's ridiculous. It's very real. The nerves to the brain have not gotten the message yet that that leg is no longer there anymore. And so they will frequently still complain of pain to a body part that is still missing. It is still very real pain for that person. So please keep that in mind and don't just poo-poo it that, oh, they don't even know what their leg's gone and they're still complaining of pain. They just want pain medicine. That is not the case. Phantom limb pain is a very common thing to see after an amputation. And we will stop there.